There's other problems, reliability and validity. Let's take reliability first. We're getting these answers from people, but how reliable are they? You know, if we get a valuation today and then ask the same person the same question in the future, will we get the same answer or remotely the same answer? Well, this was another thing that we explored in Burkina Faso study. We asked them the same question, the same people, twice. And what we found was sort of okay, but not great for reliability. The measure of reliability being used here is something called kappa score, 0.539, 0.467, 0.554, 0.621. These are typically seen as moderate, 0.41 to 0.6, good agreement, 0.6 to 0.8. So it's moderate to good agreement. So people's, essentially, those who were giving quite high values first time we asked them, were giving quite high values second time. Those who were giving low values first time were tending to give low values second time. So there's some reliability, but what was interesting was the mean willingness to pay was about 25% lower when we went back the second time. Now the second time when we went back, so I say we, it's a research team, I've been to Ghana, but I've never been to Burkina Faso, so I didn't quite make it there. The team went back 4 to 5 weeks later. And our ex post explanation is that it's a rural area and people's wealth is kind of wrapped up in their crops and food stores, not so much in things like money or possessions. Our thinking was 4 to 5 weeks later, your food stocks were 4 to 5 weeks lower. And so you actually felt poorer. And that might be why willingness to pay came down. Although coming down 25% in 4 to 5 weeks is a bit of a large gap. So maybe a concern there about something going on. So that's reliability. Let's go back to validity. So validity, the question here is, we've got these numbers from people, we've got these values. Are the responses actually people's maximum willingness to pay? And that's how we're interpreting them, but are they? And to the extent that this has been tested, people have then tried to ask, are these willingness to pay a good guide to subsequent behaviour? So it's a bit like they are stated preferences. Let's now think about revealed preferences. So are they a good guide to subsequent behaviour? And there's a few studies that have looked at this, very few. And this is a study by Onwujukwe, a Nigerian health economist, and quite an old study, but there's really so few of these studies about. And what he had done was he'd done a willingness to pay study for insecticide-treated bed nets. It was in southeast Nigeria. And within 1 or 2 months of asking people how much they're willing to pay and would they be willing to pay for insecticide-treated bed nets, he went back and gave people the actual opportunity to pay the money and purchase the nets. And what he found was the willingness to pay statements, this is the response to the hypothetical option, predicted 80% of subsequent decisions. So the only ones that were wrong were these 40, or wrong, were inconsistent. And so on the diagonal, these are people who, the upper diagonal here, 128, they gave a hypothetical yes, and they actually did pay it subsequently. Down here, we had 32 people who, to the hypothetical question, said no, and subsequently didn't purchase. It's this group here with the 40 or 20% of them who had said yes, but then said no.
So it's a yes-saying bias?
Could be. Yeah, it could be yes-saying bias. It could be people's circumstances had changed in the interim, some of them, but none of these people's circumstances change. Circumstances change for the better sometimes. It's not always the worse. But there are very few studies of this type. Actually, I had another student from Thailand. Sounds like a good recommendation for Thai students. And he was a public health, or dental public health, don't know what you call them, dental public health person. And he did a willingness to pay study in Thailand, and he was particularly interested in dental health insurance for children. And the first time I heard that, I immediately had the idea he was trying to sell dental health to children, but obviously it's the parents, and it's a health program for children, because particularly in Thailand, there's major problems of dental health in young children, effectively dietary led or stimulated. And so what he'd done was a willingness to pay study, and then go back and give people the actual opportunity to buy the plan. And it was a very interesting study, and basically he found that the willingness to pay could only be relied on when people said they were fairly sure about their answer. So he did the willingness to pay study. He then asked them, how sure are you about your answer? Very sure, or yes, I'm pretty sure, not too sure, oh, I really don't know. And so he found that those people who'd said, yeah, look, I'm fairly sure about my answer, for them, the willingness to pay predicted quite well. But as I say, there's not very many studies of this type about, partly because they're quite difficult to do in a health context, and partly, well, there's ethical issues sometimes. What he actually had to do to get around the ethical problem was, once he then gone back and sold them it and got the money, he then went back again, gave them money back and said, and by the way, I've organised it so you can have the dental health for free for a year. And so, nobody was hurt in the making of this research. But you can see there's ethical challenges in doing research of this type. So to summarise that, we don't have much evidence about validity, but some evidence we've got is supportive. We have a bit more evidence on reliability, but again, the evidence is sort of in the middle. There are some problems with reliability, but it's not completely unreliable. So let's now move on. That's money for you, and some of the challenges. Let's now move on to well-being and life satisfaction. And these are just some references that might be relevant if you're interested to follow up. Okay, willingness to pay and well-being valuation. Willingness to pay, if you try to describe it in more theoretical terms, willingness to pay essentially focuses on expected utility. Well-being is a different approach. Well-being emphasizes people's experience of a condition. So an example of a well-being question in general is, all things considered, how satisfied or dissatisfied are you with your life overall, using a scale 1 to 7? Now, if somebody stopped me in the street and asked me this, I think I would burst out laughing. But this is probably the most common wording of the well-being question. All things considered, how satisfied or dissatisfied are you with your life overall? 1, very dissatisfied, up to 7, very satisfied. Life satisfaction is seen as being a sort of mix of the positive and negative emotions, and also some cognitive assessment of how well your life measures up to your expectations and your aspirations.